Hi, my name is Megan and I'm a nursing student at the University of Michigan and I'm going to present a patient to you. Patient is a 69-year-old African-American married male. After assessing the patient's vital signs, it was clear that the patient was recovering well. Arterial pulse pressure was 72, respirations were 20, arterial blood pressure was 124/76, and temperature could not be concluded at this time but would be expected to be normal. Patient stated no medical problems in the past other than a recent blood pressure problem. Patient's father has also had blood pressure problems in the past. Patient is a diabetic, but the patient stated that he has an easy time keeping that under control. The patient is on 3 medications, including insulin, blood pressure meds, and pain meds for his ankle. The patient was unable to recall the names and doses of his medications. Patient has no allergies to any medications. Patient has no surgeries prior to his pacemaker surgery. Patient states he consumes alcohol on occasion but does not smoke. Patient exercises regularly and feels normal, but states that his broken ankle has made exercise and mobility more challenging. The patient has a normal and regular diet. The patient feels he is healthy and has no major medical issues. Patient states he has a normal sleep pattern and has no problems concerning his head, ears, eyes, throat, and neck. Patient states he has no neurological problems. Patient has joint pain and swelling in his right ankle due to breakage and has no history of arthritis. Patient is very eager to get back to his normal lifestyle with his wife and grandkids. Patient has been placed in the Heartland Medical Center for rehabilitation over the past month because of a sudden drop in his heart rate to 30 beats per minute. This decrease in heart rate led to the patient passing out and falling, which resulted in breaking his right ankle. The patient is currently on crutches, and his right ankle is wrapped in ACE bandages. Patient also has a pacemaker inserted in his chest about a month ago due to the sudden drop in heart rate. Patient has been living in Heartland for 1 month, receiving rehabilitation for his ankle and monitoring of his new pacemaker. The patient is recovering very well and is planned to be discharged tomorrow and is very excited to go home. Due to the patient's recent history of blood pressure problems and a new pacemaker, a cardiac assessment was performed. All findings were normal, which was expected due to the pacemaker's regulation. Pacemaker was visible during inspection. When auscultating over the pacemaker, prominently loud but normal sounds were heard. Heart sounds in all 5 areas were normal, and S1 and S2 were auscultated and normal. No S3 or S4 sounds were heard. No heaves were inspected, no murmurs were heard, and chest symmetry was symmetrical. The pacemaker was located just below the clavicle on the left side of the sternum in the heart 1 month ago. Due to the patient recently breaking his right ankle, a musculoskeletal assessment was performed to test the range of motion, pain levels, warmth, and possible findings of arrhythmia and crepitus. All findings were normal and no arrhythmia or crepitus were found. Muscle strength was very strong throughout the body at a +5. The only concerns in this assessment were dealing with the patient's right ankle joints and muscle strength, which ranged at about a +0 because of the immobility because he had broken his ankle. Because of the decreased strength and immobility in the patient's right ankle due to breakage, the patient has been placed on crutches. The patient states that the crutches are going well, are very easy to use, and help reduce the pain. Patient states that the pain is never higher than a 3 on a scale of 10 due to the pain medications he's on. Another assessment that could be performed on this patient would be an integumentary assessment. This assessment would be useful because the patient received surgery for a pacemaker 1 month ago, and it is important to see how the scars are healing from surgery. According to a journal from the U.S. National Library of Medicine, specific wound care instructions will be provided by the doctor to the patient at the time of discharge because wound care is important to assess after surgery and the patient should be aware how to monitor the wound once discharged. Throughout the rest of the body, findings would be expected to be normal and his scars should be healing properly. Checking for any pressure ulcers would also be important due to the fact that the patient has been laying in bed for a month and his leg isn't very mobile. Because the patient moves around often with his crutches and rotates in bed, expected results would be normal and free of pressure ulcers. A final assessment that could be performed on this patient would be a respiratory assessment. According to the Journal of Infection, the patient is at high risk for fluid pneumonia because of living in a nursing home, and death rates can be much higher if the pneumonia develops in a nursing home. After performing this assessment, the findings would be normal because of the patient's normal lung sounds and negative test results for pneumonia.